Hi everybody, I'm Amy from Body Fit by Amy, and today I am talking to Dr. Marcy Crouch. She is a pelvic floor physical therapist, board certified in women's health, and we are both busy moms of two. And I just wanted to talk to her about some common pelvic floor issues, some things I talk about a lot, and give you all a little bit more information from her standpoint. So let's talk about diastasis recti. So first, I call it diastasis. You, I think, say diastasis.
Yeah, diastasis.
Does it matter?
Tomato.
Okay.
Yeah, that's nice.
So all the same. But let's talk about what it is. What is diastasis recti?
Okay. So diastasis or diastasis is basically just a separation of the rectus abdominis muscles from its central insertion point, which is called the linea alba. So the rectus abdominis are our six-pack abs. They go from the sternum all the way down to our pubic bone, and they just are straight down like this. And during pregnancy, to make room for the growing baby in the uterus, sometimes the muscles will kind of separate or migrate away from their central insertion point, the linea alba. And so what we are left with is a gap, and that can be anywhere through the abdominal wall. Sometimes people have a gap higher up, sometimes it's right around the umbilicus, sometimes it's lower. It can be any shape. We can have kind of like a parallel one that comes straight down. We can have kind of more of an eggplant shape. We can kind of have a round one. It all varies and just kind of depends. But something that happens a lot during pregnancy is a very common finding postpartum. Sometimes it can lead to some other issues down the road, some pelvic floor problems, back pain, incontinence, prolapse, that sort of thing. So something definitely that is appropriate to be treated in physical therapy, and with appropriate exercises, we can see a good kind of change in the function of the abdominal wall.
Yeah. Great. So as many of you know who have followed me, I did have diastasis in my second pregnancy. So it is important to note that you can be doing everything right, if that's even a thing. During pregnancy, I was avoiding the planks and the push-ups and crunches and things that I tell you all to, and I still got it. So sometimes it is just what your body's going to do. Happens a lot with multiples if you have twins. It just kind of depends on a lot of different factors. There's a genetic component, correct?
Yeah, I definitely think there's a genetic component. Just how lax and how stretchy your tissue is and how it responds to load. There are some people and some studies that say it's like big babies versus small babies. Are you carrying lower? Are you carrying higher? That sort of thing. Quicker pregnancy, like subsequent pregnancies that are a little bit kind of back to back. But it's really all over the place that I've seen anecdotally in my practice. I've seen women with 10-pound babies that don't have any separation and women who have had 5-pound babies and have a large separation. So yes. I do think there's a big genetic component to it, from like the risk factors that we don't have any control over. But there are some things that you can do, to try to reduce the risk if possible, during pregnancy and right after.
So let's talk about that.
Yeah.
So, I'm even in my first pregnancy, I was still sometimes doing, planks and push-ups at an incline or things that I thought were, and they were reducing the risk. But in my second pregnancy, I was very, very careful, and that's when I got it. So again, it can happen to anybody. Yeah. But what are some things that you would tell people that we should not be doing during pregnancy to reduce the risk of that happening?
Yeah, it's hard.
It is hard. There's not a lot of right and wrong.
Right, and it's so hard to have like a blanket statement. But generally speaking, like normal exercise guidelines during pregnancy are to continue your current level of exercise without increasing.
Yes.
However, as you progress through your pregnancy and we have more demand placed on the anterior abdominal wall, it's probably a good idea to not incorporate positions that also have gravity, pulling down on the abdomen. So this would be like, a plank position, a full push-up, that any sort of extension, very high, kind of past neutral, like if you're doing back bends or extending over a ball, you don't want to kind of pull that tissue there. And also certain positions where you might be closing your glottis and bearing down or doing a Valsalva maneuver. That's really kind of like putting force down on the pelvic floor and the abdomen. We can see a little bit more of that kind of separation or that doming or tenting effect that you might notice when you're pregnant, where you're like getting up from the chair, coming up from a reclined position, and you see kind of that like point. So there are ways to correctly engage your abdomen and your pelvic floor prior to doing those activities that decrease the tenting. So you're not putting more pressure that way. So those are some things to avoid and some things to try. And then I also am a fan of compression garments during pregnancy, like specifically compression leggings and like a grade 1 medical compression that's safe during pregnancy. That comes over the abdominal wall to just give you a little bit of that external support. Not like a binder during pregnancy, not just like a Velcro binder, but kind of like a graded support system to just like give the linea alba and that first layer of muscle just a little bit of external support.
Great. And I think that it's important to note, so that's actually how I found out I had diastasis, and it was pretty early in my second pregnancy, like maybe 14 or 15 weeks. So usually those recommendations that I give are more second and third trimester, but I almost would say as soon as you know you're pregnant, stop doing your plank, stop doing, it's just not worth it. There's other ways to work your core. I have lots of videos on that. But I was washing my hair and I just was barely showing and noticed the coning or the doming. And then I would just kind of test it, like if I lean back for something or getting out of bed. So that's another thing that's important. All of those things coming up from your back, out of bed, off the floor, turn to your side first. Like all of, that's another thing. So many little everyday things that are hard to avoid. If when I was pregnant, my toddler woke up crying in the middle of the night, I'm not going to take my time to roll. I probably should have. He might have gone back to sleep. But, but as much as you can, being aware of those positions that put what we call intra-abdominal pressure on your abdominal wall, right?